and passed Medicare. And all of us know that if you look at the debate from that time, there were a lot of naysayers. There were a lot of people who said it was a Stalinist plot. There were others who said this was a communist takeover. And yet, 45 years later, 45 million Americans have more economic security and economic freedom because of that legislation. As we started out on this great debate and listened to the stories of the American people, we also heard a lot of naysayers. There was a lot of misinformation out there. But when the President of the United States signs this bill, people are going to find out that all those things that people said were not true, that there are no death panels, and they're going to find out what this bill does for American families. And you're going to have families whose children were denied coverage because of pre-existing conditions who are now going to get it. You're going to have seniors who get a little more relief in paying for their prescription drug coverage, among all the other changes in this legislation. And I believe after tonight's vote, the truth will win out. And it is due to the stories the American people told our members, and our members doing their jobs truly as elected representatives. So I want to thank the team, and I want to thank the Speaker of the House for making sure that health care reform lived to see this day. Thank you. And now it's my privilege to introduce somebody who's been fighting this fight for a very long time and helped bring us to this important moment, the Chairman of the Energy and Commerce Committee, Henry Waxman.
Within the next 2 days, the President of the United States will sign national health insurance into law. Within a week, he will sign additions to that legislation as part of the reconciliation bill. And in addition to that, major reform in the area of education as well. The President of the United States will show the American people that he has led us for change to do important things that have not been done for decade after decade after decade. With the help of this very, very talented leadership team, especially Speaker Pelosi, we were able to get his agenda passed through the House of Representatives and in conjunction with the Senate so that that legislation will be before him for his signature. He reached out to the Republicans. He so badly wanted them to work with us. They said no, and we had to do it ourselves. It would have been better had we worked together, but they said no to the American people, no to change, no to health insurance for the uninsured, no to the desperation of people who could find no way to get access to the doctors and medical help that they needed at a time of crisis. We are here to say yes to the American people. The Democrats had to do it alone, but with President Obama and Speaker Pelosi, tonight we did it. And I'm pleased now to yield to my fellow Chairman George Miller, who has been a champion not only for health care, but for education policy as well.
Well, thank you. And I want to thank the Speaker, Steny Hoyer, Jim Clyburn, our entire leadership team, the committee chairs, for the honor of being involved in this great debate in the Congress and in the country over the last year and some months. Tonight, we answered the call that the President gave us when he came to the Congress after his election, his inauguration, and asked us to reform a health care system and an education system to bring them into the 21st century so that we could add to the productivity of the American people, we could provide the health security for America's families, we could make college more affordable for their children. Tonight, with the votes that were placed in the majority on behalf of these measures, we were able to deliver that to the American family. I can't tell you what it means after 36 years as an elected official and member of the Congress to be able to say to American families that never again will they lose their health insurance and never again will they have to worry about their health security for themselves or the members of their family. It's a very, very exciting evening, and I thank the leadership of President Barack Obama and, again, the Speaker and the leadership team. And I also want to celebrate a magnificent, magnificent integrated joint staff effort of all of our committees and the leadership staff. Thank you to all of them who spent many, many 24-hour sessions making this a great piece of legislation. Thank you. Excuse me. Sandy Levin, Chairman of the Ways and Means.
Thank you. Madam Speaker, our incomparable leader. Tonight was an action in the best of American tradition. It was not a break, it was a continuation. As I think about it, like Social Security, like Medicare, Medicaid, the Voting Rights Act, what happened, I think, tonight was this. We spread the American wings of opportunity and community, and we will go home with that conviction. Now my classmate, Louise Slaughter.
Good evening. It's been a very nostalgic day for me. I started in the Capitol early this morning before the chamber had even opened, and a walk with my grandson, thinking about all those who have gone before. You know, those of us who are privileged to participate in the writing of the nation's laws are truly blessed. And yet the most important thing about the job that we have is that we benefit by the millions, people who will never even know our name. It is, I think, the finest opportunity that any citizen of the United States ever has. And I'm so proud to be a part of it. And I am so proud, I'm bursting with pride that I am a part of a group which has worked so extraordinarily well together. I really believe, as somebody said a while ago, that there's nothing now that we can tackle. If you have any problems in the world, anything that concerns you, just give us your ideas. Thank you, Madam Speaker. Thank you, my colleagues. And now, okay.
As the Majority Leader mentioned earlier, it has been an honor for us to call Mr. Dingell colleague in the Congress of the United States. It's important to note, though, that his commitment and his family's commitment to the issue of health care, for one issue, goes back decades. His father was a leader, or relentless advocate and leader for health care for all Americans, starting, in the 30s, John? Before that. Oh, my God. Before that. And when John came into Congress in the footsteps of his father, he picked up that gauntlet and continued the fight. As the leader said, he gavelled the Medicare legislation into law. What a thrill. And what a remarkable, remarkable set of events that he is here today as he called for the recorded vote. See, he couldn't gavel because he's on a committee of jurisdiction, or else he would have gavelled this vote down, too. But he calls for the recorded vote on this legislation that honors his family's tradition, their commitment to a better America with health care for all. It's an honor, again, for all of us to call him colleague. We've learned from him, and we honor him every day that we serve with him. He honors the Congress even more so than he said before.
Bless you, Madam Speaker, and congratulations. You did a great job, and we're all very proud of the work you did. Your leadership was remarkable, and we all owe you a great debt. And you, too, Mr. Hoyer, and our whip, who did such a fine job of counting, and the committee and the subcommittee chairman, who aren't getting the pat on the back that they've got coming. But if you're looking at me, you're seeing a great big Polish smile. Because Pop started out on this, Madam Speaker, in 1914 when they fired him for Union activity and sent him west to die of tuberculosis. Well, they fooled him, and if he hadn't done that, I wouldn't be here talking to you tonight. But what we've done tonight is something that is behind every other major industrial country in the world. But we finally did it. And we did it without a single Republican vote. And that was a remarkable piece of leadership by yourself, Madam Speaker, and by Senator Reid over in the Senate, where he provided some very remarkable leadership. This is an extraordinary bill. You've heard the good things that it does. There is one very large gripe, which we're hearing, that ought to be noted. And it's the only complaint I've heard which is right. And that is the insurance companies are complaining that we're going to cut Medicare. And they're right. But we're only going to cut the Medicare which overpays them by 150%. Now, that'll show a little bit about the kind of falsehoods. And I've got to tell you, the air has been redolent with falsehoods and deceit. And Madam Speaker persisted clear through this, and my